Do you want to get healed? Do you know that there are many paths to healing and holistic healing is one of those options that you have? Do you want to learn from an integrative holistic doctor who have healed many patients, including cancer patients? Well, if you answered yes to any of these questions, I'm very, very excited because today we have a very special guest. He is called Dr. Romy Paredes. Let me read more about Dr. Romy so you understand more how his expertise for the last 20 years have helped so many people heal from all kinds of sickness and diseases and also cancer. Let me talk about Doc Romy and let me read his bio. Dr. Romy is a holistic integrative doctor with the mission of helping individuals find ultimate healing through a holistic approach. He is a lifestyle medicine physician, certified as a diplomate of the International Board of Lifestyle Medicine. He is an author, retreat facilitator, and public speaker on wellness and wholeness. He finished his medical degree at UP at the University of the Philippines PGH Medical Center, and he is also a trained integrative medicine at Reno, Nevada, USA. After seeing to more than 20,000 patients and 24,000 patients to be exact for the last 20 years, Dr. Romy has seen the pace of suffering, pain, and frustration. That's why he is on this mission of helping people heal holistically. Well, if you don't know me yet, before I bring Dr. Romy, let me introduce myself. My name is Wandalyn Tan-Kalupig. I am the 2023 Top 15 LinkedIn expert in Dubai and the 2021 number one most influential Filipina on LinkedIn. Today, this is called the Cancer Conversation podcast with Coach Wanda. Our goal on this podcast is to share insightful information from healthcare experts like Doc Romy. And of course, to share also inspiring stories to help people who are actually experiencing cancer and similarly their caregivers to offer support, shared knowledge. And if you want to avoid sickness, avoid cancer by any means, please tune in because Doc Romy today will share a lot of information how to prevent, detect, and cure cancer holistically. So without further ado, let me bring Dr. Romy on stage.
Hello, good day, everyone. Good morning, good afternoon, good evening, as whatever is your time zone. Thank you, Wanda, for
Thank
inviting me here.
Thank you, Doc Romy. I know you've been a guest for us at the beginning of the year, but I think, what I love about your work is how you have really healed a lot of cancer patients holistically. And maybe, doctor, in the introduction, I spoke about you've met and already, had 24,000 patients and from all kinds of sickness. Now, I know cancer is one of those things that you help people heal with. Can you share a bit of story? How did you, come up of how do I help cancer patients? Because I know these patients are on a different spectrum of sickness. Can you share a bit of story about, your journey helping cancer patients?
Yeah. So my journey started when I was searching for the truth. When I was asking myself, what is authentic healing all about? What are the conditions for authentic healing to happen? Do we have to push healing or do we just have to allow healing to happen? See, I'm not an oncologist, but I ended up seeing a lot of cancer patients who come to us for complementary healthcare. In addition, and in complementary to the standard healthcare, we are on the softer side of healing, if I may say. And again, 24 years ago, I witnessed a little boy undergoing a treatment for cancer. And that has been transformational for me because it opened my heart and I began to surrender the arrogance of my mind when I saw the suffering of that little boy. I was still in the hospital before and I was already searching and asking, why is that little boy shouting to his parents he doesn't like it anymore? So that's what happened. So I witnessed that situation, that a little boy with cancer undergoing treatment was shouting to his parents that he doesn't like to continue anymore. So I have seen the pain and the suffering of that little boy. And I finished medical school asking to myself and to the whole world, what is authentic healing all about? Then I went to then I searched for book after book after book, or seminar after seminar after seminar, or I even went to other countries in search of that question in my head. What are the requirements, or what are the things that could make authentic healing happen naturally, spontaneously, and holistically?
Wow, that's quite a story, Dr. Wright. You know what I learned throughout my journey in life is that really one event, in your life can totally change something. And as you shared the story of this boy who was shouting about his pain, on the cancer treatment, I think, it changed your life into finding the true answers of really how to heal cancer authentically, holistically. Now, Doc, I think it's not about what's right or what's wrong. And as you rightly said, whatever you're doing is a complementary to that what people are seeking now. And maybe from your experience seeing many cancer patients for the last 20 years, can you tell us more? What are the common problems? What are the symptoms for that matter that's an indication that you might be having cancer?
Okay. So there are many symptoms. It could range from no symptom at all. Yes, there are cancer
Mm.
patients who have no symptoms at all, and they just find it out when they have these annual laboratory tests or annual exams. But the range could go also into a very symptomatic cancer patient, like, a lot of pains, a lot of aches, some chronic constipation that lead to colon cancer, for example, unwavering cough or cough that doesn't go away, headache that is so severe, or weakness that is unexplainable, or weight loss that is unexplainable. So there are so many symptoms that could be cancer already. Of course, the appearance of the symptoms will not finalize the diagnosis of the cancer. That's why in standard medicine, we still have to do a lot of tests to confirm. So we call this confirmatory tests. There are tumor markers, but of course, the ultimate test is the biopsy. The biopsy, because there was a tumor already that is seen on a diagnostic imaging, like a CT scan, an ultrasound, or an MRI, or a PET scan, or whatever. But at the end of the line of the diagnostic process, it will be the pathologist who will say the final diagnosis.
So I think, Doctor, what's scary here, based on my research, there are about 19 million people who was diagnosed with cancer in 2020. That's new cases, and in terms of death, cancer is the second cause of death globally. And I think what's even more scarier is what you said here, that it's sometimes there's no symptoms at all, and symptoms can vary from weight loss or weakness, or something that you thought was normal.
Mm.
Maybe, doctor, and you also said about the biopsy and this test that you need to do to confirm whether it's cancer or not. And I've been reading a lot. And I think one of the things that needs explanation also here is, biopsy is a process for you to confirm whether it's a cancer, but the biopsy itself has both positive and negative side that could trigger the spread of the cancer.
Mm.
Can you shed more light about this? Because I know a lot of doctors, I know they're busy. It's not about, but people need to understand when you do the biopsy, this could be the implications, and if you don't do it, what could go wrong? Can you
Yeah,
expand more
yeah,
about this kind of test?
yeah, yeah. As a medical doctor, because I'm a medical doctor, I understand. I fully understand that the ultimate confirmatory test, whether it is cancer or not, is actually the pathological diagnosis, which requires a specimen. And for us, for the medical professionals to get a specimen, we need to poke the tumor.
Mm.
Standard treatment or standard understanding says there's nothing wrong with it. In the internet, there are so many other conflicting opinions about it. I would like to play neutral about the biopsy. Some are scared, some are not, some just go for it. But majority of the medical profession say there's nothing wrong with it. Based on experience, a lot of people are willing to undergo biopsy. At the same time, an increasing number of people are scared to do biopsy because they ask their neighbor, or they research, or they Google, because the conflicting opinion on biopsy, I would say, is theoretical. Why theoretical? No one can prove, honestly, that when you poke a tumor, it can actually spread the tumor. So they call it a theoretical risk, in fairness to the topic of whether it is safe or not. So when a patient comes, I tell them it's up to you. But I tell them, of course, that that idea or that possibility of a theoretical risk, and I let them research. However, there are also many types of biopsy actually. So there is a incision biopsy, meaning you cut a portion of the tumor. There is an excision biopsy, wherein you scrape the whole, you scoop the whole tumor, you excise it. And there is also the needle biopsy, which is what is actually being said or being concluded, or it's the opinion of some that the needle biopsy can poke the tumor and can cause a spread of the tumor. Again, I'm not here to say it is true. I do not know. Maybe it's a theoretical risk, but again, it's a theoretical risk. So let people Google it. Let people decide on it. But it's also nice to know that there are differences in opinion about that. I think the safest is the frozen section biopsy, because in the frozen section biopsy, when the tumor is if a sample of the tumor is excised from the tumor, if it is malignant, then they do an immediate surgery. So I think that will eliminate the so-called theoretical risk. So because again, no one can prove, no one can say that when you poke a tumor with a needle, the tumor will spread. Unless there is a technology that will go together with the needle, that while it is going on inside the tumor and something falls off and it is taken and a video is taken, but there's no technology to do that. So it's a matter of informing patients, informing people the current information about the pros and the cons of a biopsy. Because the dilemma also is, if a patient do not undergo biopsy, standard treatment may not be able to proceed as smoothly as when there is a biopsy. Because there are legal implications if you do treatments that you have not confirmed, confirmed the disease. So
I think that's a good explanation, doctor, right? And I think at the end of the day, as you rightly said, it's a theoretical risk. And I think, in everything that we do, there's always a risk of doing and not doing.
Correct.
And as a patient yourself, I think it's good to seek help from experts like you, from
Mm.
expert oncologists to give you that advice, what kind of biopsy is required. And if you do the biopsy, it's good
Mm.
to understand what are the pros and cons of doing and not doing.
Mm.
But doctor, maybe you can share more information. I know you had a lot of patients who are scared of biopsy and did not do it, because they're scared of confirming it's cancer and scared of this cancer spreading because of the biopsy. Now, maybe can you give us a few examples of what, did that patient heal naturally without doing any further test, and what did they do for that matter?
Yeah. Uh, Based on our experiences, it depends on the what type of cancer. For example, for breast cancer, who did not undergo a biopsy, therefore they also opted not to undergo operation. Some could go worse actually. That the breast tumor could erupt and cause a big wound and with oozing blood and bad smell. I have seen cases like that. And the patient in the end wanted an operation, but they cannot find anymore a surgeon who is willing to do it because it's no longer operable. Uh,
Mm.
but there are also some cases that they opted not to do this the standard treatment, and they also recover for whatever reason. Like I know of one patient, she's from Palawan. She had a biopsy. I saw the biopsy, and she did the biopsy in my alma mater, PGH, and it is invasive ductal carcinoma. But according to her family and to and according to most of us doctors, he's hard-headed because he did not do what we were telling her to do biopsy. I've seen her a long time ago, and I just saw her a few days ago, and he's still alive. Uh, I remember she did not undergo any surgery, any chemo, any radiation therapy. She did not undergo. I'm not saying she did the right thing. All I'm saying is that's what she chose, and she's still alive. So I always tell patient, whatever you believe, whether you believe what you're gonna do will work or you believe what you're gonna do will not work, it can be both correct.
Mm.
So be careful with your belief. There is a biology of belief. You can read the book of the cellular biologist, Dr. Bruce Lipton. The title is The Biology of Belief.
Wow, I think that's enlightening, doctor, right? Because a lot of people, I think, the number one reason why we are lost because we believe in so many things. I mean, you believe in what people said, you believe in this, you believe in that. But I think what you rightly said here is to tune in and to understand what do you believe in. Because if you believe that you need biopsy and it will be helpful, then it will work. If you believe that it will be harmful, then it will be. But it's good to hear that there are examples of this patient that you had did not do biopsy but was able to heal and she's okay. Maybe, doctor, you can share what did that person do, because I think it's intriguing to understand if she had this lump in her breast but she did not do any biopsy, did not do any test, but she's perfectly well now. What are the things that she did to really heal naturally and, as you said, authentically?
Yeah, from what I've known, from what I remember, she has been proactive in her healing process.
Mm.
She was our treatment process during her journey is just actually a part of the whole process that
Mm.
we went through. So I'm not saying she only went exclusively through our own programs, but I remember she was very proactive. She was reading, she was talking to people, she was going to places, really searching also for the answer. What is authentic healing all about? And I put in the chat here because I remember her name, and I remember she's a very open person because she's willing to talk. Actually, she's willing to share. And that's why I put the name. And if you want to interview her, you can. But of course, I will ask her first. I put the name in the chat here because uh, so that I will not forget, and we will not forget in case you need someone to talk to. Uh, so she has been reading books. She even enrolled in some courses on health and wellness here and abroad. And in the eyes of most physicians, she is hard-headed. But that is sometimes what I see in cancer survivors. We
Hmm.
we look at them as hard-headed. In Tagalog, matigas ang ulo. But this actually is one of the ingredients for authentic healing to happen, because they become proactive, not passive. They begin to understand why the tumor is there, that it is actually not there to kill them, but actually there to change them, to transform them. It is a healing of perception, really.
Wow, that's good to hear, doctor. And thank you for sharing her information. I would love to have her on the podcast because you know what I also learned is that breast cancer is the number one, in terms of the breast the cancer problems that women have, breast cancer is the number one. And I think it's good to hear what she did, in terms of other than seeing Doc Romy. What are the other ways that she was able to heal herself? And I think I like what you said that, those people who actually become stubborn and take their health on their own terms became, he was able to heal themselves. And actually, that brings me, Doc Romy, I actually read your book. It's called Transformation Medicine, Pathways to Becoming Your Own Best Doctor. Now, the example you gave of this patient who have problem with her breast was able to heal herself. I think she has become her own best doctor, which brings me actually to the next question. Because right now, the way society is designed is that I'm sick, I'm gonna go to the doctor, tell my problem, and tell him the solution. But I know because I used to be sick always 10 years ago, but I've learned how to become my own best doctor too, in terms of tuning into my body, understanding what I need, even without seeing the doctor. I was able to heal myself and my children. Now, doctor, this becoming your own doctor is a very big word to many people who don't understand how can you heal yourself. Is that even possible?
Mm.
Can you share more? How can you really become your own doctor, and what does that mean?
Okay, yeah. First, let me differentiate between an acute disease and a chronic disease.
Hmm.
Acute disease meaning like a trauma or an
Hmm.
accident or an acute appendicitis, or you need a surgery right away. For acute diseases, we need to go to the hospital. We need to go to the doctor. For example, if you have a stab wound, don't go to a wellness center. Don't go to an acupuncturist. Don't go to a holistic retreat center. Go to the hospital. If you have an acute pneumonia, take a medicine because it is already an invasion, a bacterial infection, invasion. You don't like a sepsis to happen within your body. But for chronic diseases, most chronic diseases are lifestyle related. People have self-manufactured their hypertension, their diabetes, and their cancer. Of course,
Hmm.
nobody consciously did it, but unconsciously, day by day, pattern by pattern, habit by habit, that's how we accumulate the chronic disease. And when we have a chronic disease and we only rely on an acute intervention to eradicate the tumor, for example, but come to think of it, did that tumor form since yesterday only? No. It took
Hmm.
a while for that tumor to form because something went wrong. Maybe an accumulation of toxicity, an accumulation of deficiency in the body, or however they call it, genetics or whatever. So for chronic diseases, I believe over and above, over the complementary, the standard treatments, there are many complementary treatments that could also help a patient unravel and discover what is the cause. Now, it's very important for a patient to differentiate between treating the symptom and treating the root cause. Of
Hmm.
course, ideally, we have to treat the root cause also while patients are treating the symptom of their problem. Yeah, I understand. Sometimes we need to treat the symptom temporarily, but if we do not treat the root cause, which is very logical, then the disease is only covered or is only hidden, and it will come back again. That is why I have seen so many patients. They underwent a lot of treatments. They were declared cancer free, only to find out 3 years later the cancer is there again.
Hmm.
If the cancer is there again, meaning the cancer was never gone. Another understanding that I gained through the years that I've been seeing a lot of patients, not just cancer patients, but also a lot of cancer patients, is their understanding also that cancer is not just the tumor. What if the cancer is also the lifestyle?
Hmm.
If the root cause, which is the lifestyle, did not change, then the mechanisms for the development of a disease or a cancer is still there. So yes, we may cut the tumor, burn the tumor, get rid of the tumor, but it is also very important to get rid of the root cause why there is a tumor.
Wow, that's a very good point, doctor. I think that is what a lot of medicines are not doing. I mean, generally, if you cannot sleep, okay, you just take a sleeping pill and you think it's okay. I mean, I used to have that problem of not able to sleep early, but I think because it the root cause is I'm a worrier. Now,
Mm.
when I went back and wait, I'm always worried. That's why I cannot sleep. So when I was able to silence the inner critic within and manage the worries of every day, I was able to sleep quickly and effortlessly now. And I think similarly with cancer. I mean, when I was in the hospital, I've met a lot of women who are like clueless in terms of I took the treatment, I completed, but I'm sick again and it's spreading. And I can sense from their story how much they're taking the medicine but not healing the emotional wounds that they had or the other aspects of life, as you said, about food or whatever needs to be done. And I think that is what I'm excited about because I'm proposing a project with Doc Romy where we want to help more cancer patients heal holistically. If you want to take the medicine, that's good. But why not heal the root cause of the symptoms? Because that is what really authentic healing is about. And I think that's what I learned from my own journey of healing myself and others. It's about finding the root cause and solving that. And then you really become, free and healed. And that is the intention. Now, doctor, I also want to understand in terms of, I understand that a lot of people have cancer because of stress, because of lifestyle. Now, what are the things that we need to make sure that we incorporate in our lifestyle to avoid having cancer or any sickness for that matter? What is that tip that you want to give us?
Okay. So there are many levels, there are many aspects. Let's start with the nutrition, the body. So they say we are what we eat, which is correct. And I agree and I believe. So according to lifestyle medicine principles, the ideal diet, and this is science based already. There's a lot of science that proves it already. The ideal diet is plant based, whole food, low fat diet. But the standard diet of most people is the opposite: animal based, processed food, high fat. It's very rare to find a plant based, a whole food, a low fat restaurant in the Philippines.
Mm,
It's very rare. Uh, but that's our one of our dreams actually, to develop plant-based, whole food, low fat restaurants. We're not yet there. We're still in the transitional stage. Transitional means, there are vegetarian that are vegetarian recipes, they are not meat already, but still they're still somewhat processed, because that's one way of meeting people where they are. So that's one, nutrition. So that's the body. For the mind, yeah, stress is the number one problem and root cause of a lot of diseases, not just cancer, but all the chronic diseases like the lifestyle related diseases, because stress affects the entire body, the entire system. So there are many stress management programs around the world. But what I could say is a higher level to that is inner management. In stress management, you manage your external circumstances. You manage your schedule, you manage your spouse, you manage your company, you manage your employees, you manage your community. But you can never have 100% control of your external circumstances. In inner management, you can have 100% control of your inner well-being if you are willing to improve yourself, to nurture yourself. And there are actually very good programs on inner management. And I would like to share here that I finished a very wonderful inner management program. The title is Inner Engineering. It is actually
Mm.
of inner engineering. So me and my wife took that program in Hong Kong way back 2017. It was offered by Isha Foundation, and we were lucky because when we were in Hong Kong for 4 days to attend that inner engineering program, the founder of Isha Foundation himself, Sadhguru, was the lead facilitator, was the sole facilitator of that event. And we were so lucky because it was really transformational for us. Inner management. And I continue to nurture the things that I have learned in that program. And I also share it to patients by pointing to them, why don't you enroll in this inner engineering program? So I've been promoting it. Or for those who cannot attend yet the program, at least give them the idea that the difference between stress management and inner management.
Wow, doctor, that's something new, right? I mean, this is the first time I'm hearing, although I've heard and I've seen Sadhguru, I hope I'm pronouncing it right. But I think that inner management concept is really critical because at the end of the day, what I learned also, you cannot control anyone. You can only control yourself. And when you
Correct.
understand those concept of how can you control yourself, you can actually stop stressing about everything because you
Mm,
understood it. Wait, I was never in control anyway, so why bother, right? Now,
correct.
doctor, one of the things that we did at the beginning of this is a retreat because we actually in that it was one of, I will say, my life changing retreat, although I facilitated it also because I remember when I designed the retreat, we just designed it with the intention to just allow healing and allow what needs to happen. And I think the magic that happened during the retreat is that we touched upon these aspects of healing the mind, the inner management, and we only ate the good food because it's really whole food, plant-based, low fat. We only ate the food that's in the farm. Now, doctor, can you also please invite people? I know, if you want to go to a place where you'll find serenity, and I think it was a place of healing, Doctor, really. The one that you build on Wellness Land is something that's healing. Can you share more about Wellness Land? I know you do have a lot of foreigners who come and visit and somehow change their lives. So can you share more about Wellness Land and what's the recipe? I was trying to ask myself, what happened to me on Wellness Land, but it changed me on some level that's unexplainable. I
Mm,
think it helped me to understand the simple things in life that brings joy and healing.
mm.
Can you
Yeah.
share more about
Mm.
what you did there?
Yeah. So I would like to share one of my books. The title is Sacred Simplicity, The Ultimate Sophistication. Yeah. So, because as I've said earlier, we have been searching for the truth and nothing but the truth. And one of the truths that I have found is, especially when it comes to the management of cancer, it has to go beyond treatment, because
Mm.
treatment is external. We impose on that person, we treat. That's why we thought of, maybe it's no longer a treatment, or maybe there's something beyond treatment. So we ended up formulating, creating, crafting programs. Programs. Programs could be an online thing, a cancer recovery program, or it could be a program that they could go through live, like they go to a holistic retreat center. And that is one of our center in Cebu. Wellness Land Wholeness Farm is a holistic retreat center where people could go and attend a program. Or there are also some people who just go there and stay, and they follow their own program. So we call it the flow program. In layman term, it's up to you. We just provide you the place to sleep, the food, and it's up to you. Because you know what? Authentic healing is inner work. A lot of
Mm.
inner work. Every symptom, every disease that happens in our body, believe me, it is a high level wisdom. It is not a mistake. Even though we think, oh no, oh my God, there's a tumor, there's a high blood pressure, there's a high sugar. But the body is communicating. The problem is we are perceiving it in another way. That's why I have
Mm.
mentioned it in one of my books. The fastest healing is actually a healing of perception. And that is also mentioned in the book Transformation Medicine. Uh, And the most powerful medicine is transformation. Therefore, a symptom, whether be it a mild fever or a mild headache or a very serious tumor, it is a communication of the wisdom of the body. If it is mild, maybe it is just a whisper of the wisdom of the body. If it is serious already, like a tumor, a big tumor or a cancer, it's no longer a whisper. It is a shout. The body is
Mm.
shouting. So it's either we listen to the body, or we get so scared and we contract in fear, and we do everything because of fear. We do green smoothies because of fear, or we do chemotherapy because of fear. It won't work, because fear
Mm.
alone is contracting the immune system. Fear alone is closing the immune system. And there is no laboratory test or diagnostic imaging test that will say, oh, the result is you have a lot of fear. No, you cannot see that. It's because it's intuitive. You know, nowadays there is
Mm.
so much knowledge, there is so much information, but we are not
True.
paying attention anymore to the subtle messages, to the subtle wisdom of our body. Like this afternoon, I was talking to a new patient. She couldn't sleep. She couldn't
Mm.
sleep, and she's been to everywhere already looking for the answer. And then I just had a good conversation with her for almost an hour. We were talking about life, about what's the root cause, about how her circadian rhythm became imbalanced. It was just a conversation. And as soon as she went out of the room, she felt half percent better. 50% better. Uh, and then we did some acupuncture. I was trained with some very basic acupuncture, which I do to my patient. But I think it's the conversation itself, because in conversation, we bring back the symmetry of healing. Unlike in a consultation, sometimes there is an asymmetrical relationship between the patient and the doctor. So I believe in conversation because you bring back the symmetry. I tell patients, I cannot heal you, ma'am. I remember you said earlier in the introduction that I have healed. I wanted to correct you, but of course, I did not want to interrupt you. But honestly, when people ask me, have you healed anyone? My answer is no. But I have helped a lot of people heal themselves, because true healing came from within, not from without. We were just there to
Mm.
mirror to them, to explain to them, to encourage them, to inspire them that yes, if they are willing, they can actually heal themselves.
Wow, that's enlightening. I think I love that correction, doctor, how you said that, you don't heal. You help people heal themselves by finding the healer within. And I think that's the
Yeah.
one that people need to understand. And doctor, now I know we can talk the whole day with all the wisdom that you have, but this is the time now. If people want to, I always consult Dr. Romy for many things because his wisdom, he has learned so many things that I don't need to enroll in so many programs. I just need to ask Doc Romy. Now, Doc Romy, if people want to consult you, I know you do teleconsult, if they want to visit Wellness Land, and I know you also have a program which is called How to Heal Cancer Holistically. Can you share more about how to best reach you? So if people need some help and guidance, as you rightly said, I think my favorite term I learned from you, let's change laboratory into laboratories because
Yes.
there's a message in your
Mm.
sickness that only you can understand. Doctor,
Mhm.
can you share more about how to best reach you?
Yeah, so we have a website. It's www.wellnessland.org. And in the homepage, there is a booking portal for those who want to have a conversation or a consultation with us, however you want to call it. It could be on-site. We have two on-site centers. I'm based in Cebu. Wellnessland Urban Center is located in Cebu City, Philippines, and Wellnessland Wholeness Farm is also located in the mountain part of Cebu City, Philippines. It's all in our website. We also have a self-guided, self-paced, take your time, go with the flow program, no pressure. It's very cheap. The title of the program is There is Hope: How to Overcome Cancer Holistically. Just by the title alone, it is already healing. Why? Hope is a powerful vibration that opens possibilities. That's why, regardless of the stage of the patient of their cancer, I always tell them, Ma'am, sir, there is always hope. Some people would say, Dr. Paredes, don't give false hope. But my reply is, what is false in giving hope? Hope
Hmm.
is energy. Hope is vibration. If you say there is no more hope, then all the possibilities will close. But when you
Hmm.
say there is still hope, then the possibilities will open. And when I say hope, it is not just about physical healing. It could be mental, emotional, and even the higher levels of healing, which is spiritual healing. So this self-paced, self-guided, very cheap program, How to Overcome Cancer Holistically, can be accessed through our website, www.wellnessland.org. Just go to the tab Online Courses. It's very cheap, but it is very powerful.
Thank you, doctor. I've watched that many times already. I keep on repeating and then even snipping the pictures. So again, I would like to thank you, Dr. Romy, for sharing your wisdom today. If you are watching us on live or on replay, this is the Cancer Conversations podcast. Our goal is to share insightful information and inspiring stories to help people prevent, detect, and cure cancer. And we want to give, as doctor said, hope that you can be healed, hope that whatever sickness that you have, if there's a possibility for you to get healed. And it's about listening from experts like Doc Romy. We do have many guests from oncologists, doctors, cancer caregiver, and survivors. So please tune in to our next episode. If you want to partner with us as a guest or sponsor, message me or Kaltan Social Media Marketing. Thank you again, Dr. Romy. God bless you. Any last words you want to say before we end the
Thank
episode?
you. Thank you. Last words, we can heal ourselves.
Thank you, Dr. Romy. Thank you, everybody. God bless you.
Thank you,
Bye.
Wande. God bless. Bye-bye.